BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
It's Alzheimer Awareness Month. This year, the Alzheimer Society is focusing on women for good reason. 72% of all Canadians with the disease are female. That is shocking. Health specialist Leah Sarich joining us now with some early warning signs. Also talking about the one thing we should all be eliminating from our diets to keep Alzheimer's at bay.
Yeah, this is good information.
This is really
and
good
new
information.
And exciting, yes.
Yeah.
So the most common form of dementia, of course, is Alzheimer's. So this is a progressive decline in the function of the brain and the thinking that's going on in the brain. So there are two kinds. There's early onset, so that's what we've heard about that. I did that in the fall. The early onset is usually diagnosed before the age of about 60. It's quite rare, though. The more common kind starts in the 70s or later. So early onset is genetic, basically. It's got a large sort of family history component there. The most common kind of Alzheimer's, the later onset, really is about the environment. Environmental factors are here. That's sort of a multifactorial thing that's happening here. And particularly, the latest research is suggesting something with our diet. This is interesting. So we've heard lots about the protective mechanisms that go on when you eat a Mediterranean diet.
Sure.
So the opposite of that then would be the Western diet that's high in fat and in sugar. And what research is now showing that sugar is in fact the real culprit.
The problem with sugar is that not only does it increase the production of the amyloid protein, which is the protein thought to be contributing to brain damage and loss of cell structure and function, but also that amyloid protein causes damage to the blood-brain barrier. On top of that, we see that sugar is probably pro-inflammatory and increases sort of toxin-mediated events in the brain.
Sugar.
So there you go.
Bad.
Sugar, bad. Sugar is bad news for your brain.
Yeah.
So of course fat was vilified a few years ago. So the food makers basically took it out, but then they replaced it with all of this sugar. And in fact, Dr. Ismail is saying now that the problem is even worse. So yeah, really scary. Now what about these sugar substitutes, we're wondering?
Yeah.
Dr. Ismail, are really not a good option either, because research is showing that they cause insulin spikes, changes in bacteria in the bowel, also very harmful, and in fact the end result is the same.
End results.
So just another reason to eat clean, real food, protective for your brain and your overall health, of course.
Okay, sugar bad. Get rid of as much as possible.
Yes.
Okay, what about if you have a family history of Alzheimer's? What kind of warning signs should you be looking for?
Right. So first of all, we want to actually know your family history.
Sure.
So figure out what's going on. Did mom and dad have it? You know, what's happening there? Grandparents, that kind of thing. And what kind of Alzheimer's did they have? So was it the early onset kind? Because if it is, then we really need to pay attention to that. Because as I mentioned before, that has that genetic component to it. If it's sort of the older one where it sets in later in life, that again, really many things could be causing that.
Okay.
The other thing to be aware of is your baseline. So if you're always kind of a little loopy and sort of forget things and you're still that way in your 70s, it's probably not a big red flag. But if you've never been that way and all of a sudden these symptoms start coming on later in life, that's the red flag. That said, here are the most important early warning signs.
The top 5 warning signs of dementia in late life might be people who start getting lost or wandering, who are forgetful of recent events, who can no longer manage to pay their own bills or manage their household, who have a change in language with difficulty finding words or a change in the grammar of their language, and who become much more inattentive and distractible than they may have been before.
The other things also to watch out for are what they call the neuropsychiatric changes, things that we might associate with things like mental illness. So if you've never had depression before and then all of a sudden in your 70s, that's your first bout of depression, that could be also an early warning sign of disease. Yeah, could be. Certainly worth more investigation.
Anything else we can do to help prevent?
So again, good diet, like we've talked about already.
Sugar.
Exactly, get rid of the sugar. And other things, like use your brain. So stay really, really social. Get out there and play bridge. Meet your friends for coffee. Stay out there. And physical exercise. Research shows that physical exercise releases all those good chemicals for the brain, and it's very protective.
There you go. BreakfastTelevision.ca. Leah has a blog on there. All this information will be posted as soon as possible. We're